Americans who have received 2 doses of Pfizer's COVID vaccine may or may not need a 3rd dose, depending on who you ask. Here with her answer is Dr. Erica Shenoy, Associate Chief of the Infection Control Unit at Mass General Hospital. Doctor, thank you so much for joining us this morning. The headlines about this have been confusing. Pfizer says it wants to distribute a booster shot that offers better protection against the Delta variant. The FDA and the CDC both say people who are fully vaccinated don't need it. So which is it?
Yes, I agree. It's actually quite confusing when you're reading the headlines, but I think the main point here is the jury is currently out as to whether or not we're going to need a booster vaccine and when. We know from the national data right now that the majority of new infections in the United States are in unvaccinated individuals who are accounting for over 99% of hospitalizations and deaths. So that is a testament to how effective the vaccines are. That said, the data are accumulating over time as to how long individuals remain protected, the duration of immunity, and specifically also related to the variants as to how well they protect. And it's possible over the next several weeks or months, we'll learn that a booster strategy is necessary. And I think we also have to keep in mind that it may not be for everyone. There may be specific populations for whom a booster is really important, and we'll just learn that. And right now, at least at this moment in time, the vaccines appear to be very effective, even when the Delta virus variant is the circulating strain in the United States.
Okay, we know that the Delta variant is more transmissible and it may cause more breakthrough infections. Do you think we need to be more cautious in public right now, even if we're fully vaccinated?
Yes, so it is more transmissible so far. I think the good news is that we still appear to have quite good efficacy against preventing some of the most severe outcomes from disease. So even if infected, the infections tend to be mild. That said, whether or not one particular individual changes their behavior is almost really a very personal decision. So it can range from a fully vaccinated individual here in Massachusetts, where the amount of virus circulating is generally quite low. It's ticked up a little bit in the last 4 weeks, so we're watching that closely. But that's very different than other parts of the country where there may be much more virus circulating. And so the chance of you encountering someone out and about with virus is different than it is in here. So I would say whether or not you change your personal behavior is really a personal decision. You know yourself best in terms of how effective the vaccine may have been in you. So for example, if your doctor says to you, because of your medical conditions, you're immunocompromised, you may not be as protected. So you may take additional steps here. Otherwise, fully vaccinated individuals can feel confident that they are well protected from the virus.
Okay, we want to ask you about a new study from the UK that suggests the symptoms from COVID may be changing with the virus, and whether you've been vaccinated or not could make a difference. What can you tell us about that?
So these are results from the COVID symptom study, and it's an interesting study because they've had individuals reporting their symptoms in an app for actually, I think for most of the pandemic, they've been enrolling individuals. And we already know that breakthrough infections tend to be more mild, and I think it would stand to reason that the symptoms that people report in breakthrough infections would be different than in someone who is having their first infection or an infection in an unvaccinated individual. I think the take-home point is that whether you're vaccinated or not, if you develop symptoms that are consistent with COVID, that you talk to your doctor and figure out if you need to get tested.
Okay, good to know. Dr. Erica Shenoy, Associate Chief of the Infection Control Unit at Mass General Hospital. Thank you so much for joining us as always.
Thanks for having me.